Hi, I'm Jacob, and today I'll be evaluating factors that obstruct effective problem solving in the real world scenarios and procedures that facilitate problem solving. What is problem solving and why is it necessary? The Cambridge Dictionary defines problem solving as the process of finding solutions to problems. It is an essential life skill that occupations in many industries rely upon around the world. However, people's problem solving skills can be impaired in certain environments, especially in a workplace, in situations including high pressure, deadlines, or stress. One industry in particular that experiences these conditions is the healthcare industry. It's such a high pressure job due to the fact that there's a high workload, it's underfunded, they're understaffed, and they're working daily in a life or death situation where one wrong decision could be fatal. And in this presentation, we'll be looking at these issues with a specific focus on the NHS and applying relevant psychological theories to evaluate factors that both positively and negatively impact problem solving and decision making abilities of the individuals who work within the healthcare industry and specifically the NHS. Emotional stress is one of the factors that can impair employees within the healthcare industry as they're working in situations where people's lives are on the line and they may be making decisions based on emotions rather than the facts given to them. On top of this, workers within the NHS work long hours and eventually will reach a burnout point. This will lead to a lack of motivation and energy, which in turn will lead to a lack of critical thinking when faced with problems, and they may not be creative with the issues that they're faced with. Finally, as staff are tired and under a lot of emotional pressure, this may lead to impaired communication skills. Communication is very important in situations like when you're working in the NHS, because you're working in a team. It's very important that you do the job right and things like that. So, how can all this be solved? Firstly, in order to prevent employees solving problems with emotions rather than facts, employers must ensure that there's a support system that emphasizes that it's not a personal responsibility, they're just doing a job. And if something goes wrong, they are supported emotionally. And within these conditions, they're more likely to perform better under this type of pressure. The issue of fatigue can be combated by ensuring NHS workers receive more regular shift patterns and frequent breaks within their shifts. This will ensure that they have a good work-life balance and reduce their stress levels and increase the likelihood of performing better under that type of stress and pressure. The only way that they'd be able to do this is if the NHS hired an adequate amount of staff so that people are able to have more personal time off. The final issue of communication could be tackled by having workshops and team exercises. And this would help as people would understand who they're working with better as individuals and how they work and how they perform under pressure, and they'd work generally better as a team. A study by Banbury et al. Looked into how noise can affect people's concentration. They had a sample of 88 participants across two offices. Results of this study found that 99% of participants had impaired concentration due to background noise. And as we all know, hospitals and GPs can be very busy with lots of people, medical equipment, and other employees working. Therefore, all this background noise is bound to create an impairment of concentration within the employees working within the NHS, and this will therefore worsen their problem solving skills and decision making. It's difficult to diminish this problem completely. However, if more staff were hired, they'd be able to create a new wing or something that would be able to spread the noise out across the larger surface area rather than just all in one focused place, which would help with stress. And on top of this, they could hire more people to get the queues down quicker. So overall, there's less people in the hospital. An example of a study which proves the high workload of the NHS is a study by Abby Rimmer. This study was a survey of 487,227 staff in 235 NHS trusts within England. And the results showed that 38.4% of staff had stress-related sickness, and only 66.8% of staff felt confident that they were able to deliver the care they aspire to. The stress employees in this company endure is certain to impact their problem-solving skills, and this is supported by the fact that 33.2% of the staff felt they couldn't deliver the necessary care for their patients. On top of this, the NHS employees' chief executive stated their concerns have been reflected in their outcome. And this proves the significance of applying psychological theories in order to positively impact the NHS workers' decision making and problem solving skills. And one theory that could be applied to the situation is the expertise development theory, which says that someone who is more experienced in that particular field is more capable of quickly making the correct decision. According to this theory, newer employees are more likely to make incorrect calls and the lack of problem solving skills needed. This will lead to incorrect diagnostics and healthcare plans, which could lead to negative outcomes for the patient. A study by Krapinski et al. Looked into this theory with medical students throughout their 4 years of residency. They tested their diagnostic skills at the start of each academic year. They were tasked with looking at breast biopsy images and identifying three sections which they would want to look closer at in order to diagnose. An eye tracker was used to see the patterns in which the residents would scan the images for irregularities, and they found that throughout the years, the patterns changed, and year by year, they became more efficient at diagnosing the biopsies, which proves the theory of expertise development. This theory could be utilized to benefit the NHS hospitals in many ways. One thing they could do is work upon their collaboration and teamwork. This could be done via pairing up doctors with different areas of expertise, and this would help as it would lead to a wider array of knowledge for each individual doctor and therefore improve problem solving skills across the workforce. Secondly, they could implement a mentorship program. To do this, they could pair up senior doctors with a high level of expertise with newly trained doctors, and this would work as the new doctor could shadow the senior doctor and observe what they do and how they do it. This would lead to the new doctor gaining more knowledge and expertise. This links to expertise theory, as within hospitals, it emphasizes the significance of learning the skills of their superiors. And finally, if the NHS tracked progress of employees, they could notice doctors' shortcomings, and this would then be assigned to that doctor as a way of gaining knowledge and understanding and allow them to have a chance to develop expertise in that area. Heuristics and algorithms is where the individual uses past experiences and stereotypes to make decisions when problem solving. For example, in a hospital, the doctor diagnoses a patient who had cold and flu symptoms with the flu. This can have a negative influence on the NHS workers' problem solving for many reasons. For example, via confirmation bias. If an individual uses heuristics in order to make a diagnosis, then they may only look for symptoms that match their hypothesis, and this may lead to them missing key symptoms or signs that may clearly point to another issue within the patient. A second negative is the fact that they may oversimplify the issue at hand. This is because the heuristics they use to come to their conclusion may lead them to overlooking small issues that may have potential to cause serious harm to the patient. It may also lead to an incorrect diagnosis due to them overlooking it and not ignoring them symptoms. The third negative is that every doctor has a different past and experiences, and therefore will have different heuristics. This is a bad thing, as not all doctors will be able to collaborate effectively if they all believe in different course of actions to treat the patient, and their problem-solving skills might not work collaboratively. A final negative is that doctors may over-rely upon these heuristics, even when they're not the best option. Although they are quick and efficient, they may lead to mistakes that would cause longer to fix than if they didn't use heuristics initially. Although heuristics can be negative, they also have a positive impact if used correctly. For example, a doctor using heuristics will have less of a mental load than doctors who start from scratch in every case and every patient. And this will lead to them having better mental stamina and be able to work effectively for longer and provide necessary care for longer. In some medical cases, time is of the essence, and using heuristics can be crucial to curing patients as soon as possible. And therefore, heuristics should be used in medical settings if applied correctly. Therefore, employees should be trained to notice smaller symptoms that may be linked with serious illnesses and diseases, and this will lead to better processes surrounding diagnosing people and will give patients the best chance of recovery. On top of this, solving healthcare problems in a fast-paced, high-pressured situation can lead to high levels of stress upon an individual. However, with the help of heuristics, it makes a complex medical condition simple and easy, allowing them to make sufficient decisions without any environmental factors affecting them. Another theory that can facilitate problem solving and decision making within the NHS is the dual processing model. This model suggests that people have two ways of cognitive processing. The system one, in which people make quick decisions and use initiatives for fast and efficient decision making. And this is linked to heuristics and use of past experiences as when problem solving. And then the system two, which is more deliberate and planned out thinking. This is used in times where there's less pressure or where the individual is faced with a more difficult issue. Although it is more effective, it's less efficient and can use more cognitive function. Similar to the negatives of heuristics, system one thinking could lead to cognitive biases. This is because if they make an initial decision due to the system one processing, they may only look for symptoms that match their thoughts. And this is a negative as they may ignore crucial things due to these confirmation biases. On top of this, another negative is that due to high pressure situations, the workers will experience stress and fatigue, and this leads to more frequent system one thinking, which may make choices less effective, potentially leading to worsened patient safety. Although there are some negatives, it is an efficient use of cognitive resources when they're experiencing extreme tiredness and stress. This will allow them to work more efficiently throughout their shifts and potentially help more patients. It also allows them to notice patterns in health of patients quickly and easily treat them as soon as possible. The most effective way of implementing this theory to facilitate problem solving within the NHS is to suggest employees use a balance of both System 1 and System 2 thinking. For example, System 1 could be used when there's an implication in a surgery and they need to act fast to save a life, whereas System 2 could be used in order to diagnose patients where they need a more thorough process in order to know where to move on from that situation. And in conclusion, there are many environmental and emotional stresses that lead to difficult problem solving and decision making within the NHS. As stated previously, the company is underfunded, understaffed, and there is a high demand from the public for their services. Combine this with the staff who do have irregular shift patterns and work under the emotional burden that they're responsible for saving lives, and it's bound to negatively impact their problem solving and decision making skills. In an article by Stuart Hodinot, it says ambulance response times and waits in A&E are both at record levels. Bed occupancy is above 95%, and the elective waiting list stands at more than 7 million. Although these psychological theories are a step in the right direction for helping the NHS with its problem solving skills, this statement clearly shows that the main issue in question is the fact that there's not enough money being put into the NHS by the government. And more money invested would lead to more staff, more hospital beds, better equipment, and better training for employees. And this would lead to more comfortable environment for NHS workers and lead to a better problem solving skills as a direct effect of this environment. And these are my references. And thank you so much for listening to my presentation.